Thank you very much for coming for Professor Lao's seminar. We are very honored to invite Professor Lao, our former director in our school. Now is a president in Virginia University of Integrative Medicine, USA. Professor Lao's topic today is integrative medicine in USA. This is Faculty of Medicine direction in the future. Actually, he is a famous scientist in Chinese medicine and acupuncture in mainland China, worldwide, and Hong Kong, and also serves as a lot of board member in Chinese medicine professionals. Now, let us invite Professor Lao give us talk today. His topic is Chinese medicine in USA. Thank you very much, Professor Lao.
Thank you, Professor. Good evening, good afternoon, everybody. I don't know which language I should use. But anyway, I was instructed by Professor Fong I should speak English, but I maybe mixed with the Chinese a little bit. Anyhow, it's my privilege to come back to School of Chinese Medicine. I just got a tour by Professor Fong of the building. It's very, very impressive, very pretty new building, and make me regret I should stay here a longer time. It's very, very nice. Okay, so by saying that, I'm going to introduce you about integrative medicine in the United States. Okay, so just share some experience and my observation, and feel free to ask a question. We can have a discussion. All right, so first I'm going to go to outlines of what I'm going to talk. So we define what is integrative medicine. Then we discuss why it's important for incorporating integrative medicine in the medical setting, and integrative medicine models and settings in the United States, and how to incorporate the integrative medicine into the acupuncture and TCM training. Then what is the role of evidence-based medicine in acupuncture and TCM training? So this area I'm going to cover a little bit. So here, let me give some background introductions. So it's a very rapid development of the integrative medicine in the United States and all the West, we know that. So here are a couple timelines which I involved personally. In 1991, the U.S. National Institute of Health, NIH, established the Office of Alternative Medicine, called OAM, which is a very small budget, $2 million a year, very, very small. Then 7 years later, in 1998, the office became National Center for Complementary and Alternative Medicine, called NCCA-AM. Okay, so the change, upgrade, because the budget is much larger now. So in 2014, they renamed, the U.S. Congress renamed this NCCA-AM to become National Center for Complementary and Integrative Health. Okay, now they call NCCIH. So the development in the NIH. From a small budget, now bigger budget, bigger institute. So then how integrative medicine is defined in the United States? It's a little bit different from the Hong Kong in China. Let me explain to you. So the name called integrative medicine before we call alternative, additional to Western medicine. Anything other than Western medicine we call whatever which is not in normal mainstream medicine. So then also they are not taught in medical school, defined in the name we talk later, sometimes called alternative medicine, sometimes we call complementary medicine, sometimes now we call integrative medicine. But anyhow, it's not Western medicine. Anything other than Western medicine, it belongs to this category. And also usually lies outside the official health sector, okay, based on WHO definition. And also there's in Eisenberg, in the New England Journal of Medicine in 1993, the paper he defined, neither taught widely in U.S. medical schools nor generally available in the U.S. hospitals. This is his definition. So you see many different kinds of definition. And also the new definition called practice of unregistered or non-licensed practitioners. Okay, now since the change, now lots of license required. So how the name come from? What is? Okay, sometime before we call alternative medicine. Then for a while, then lots of debate in the United States. Alternative medicine, the Western medical doctor do not like it because this alternative means you replace my practice, right? Alternative. So this changed. Then also another term called complementary medicine, which is complement. So then the community in the non-Western medical field do not feel happy. They said, I complement you, you're a major, I complement you. So still argue the debating. So then also sometimes unconventional medicine is another term we use. Holistic medicine is another term because we emphasize whole body's health. Also natural medicine because we use the acupuncture, herbal medicine, many natural products and not use the synthetic chemicals. That's the way sometimes we use. And another term called complementary and alternative medicine, which NIH used this term. Okay. Then now they call integrative medicine or integrative health. So integrative medicine so far become very popular because everybody accept. Western medical doctor also accept integrative medicine from the different aspect of the medicine, and non-Western medical doctor also accept because it's not equally with the Western medicine. That's how accept. So now most of the schools, like my school, are from the Virginia University of Integrative Medicine, was before the name called Virginia University of the Oriental Medicine. Okay, many schools like us change the name, become integrative medicines, become very popular. Doesn't matter you are in the which side. And integrative health is currently NCCIH they use. And based on the NCCIH, the definition is alternative medicines, a non-mainstream approach is used in place of the conventional medicine. This is called alternative. Okay. And complementary medicine, they said non-mainstream approach is used together with conventional medicine. So you see the term differently. But integrative medicine is non-mainstream approach is combined with or integrated into the conventional medicine and then intervention. So now everyone accept this term. And integrative health is by the NCCIH. So integrative health emphasizes multimodal interventions, okay, emphasizing treating the whole body, rather than one organ system. So not for lung disease, stomach disease, they combine whole body. Okay, that's the definition. Then NCI, which is National Cancer Institute, their definition is similar, but their definition for the visit their website. There's a type of medical care that combines conventional or standardized medical treatment with complementary and alternative therapies that have been shown to be safe and to work. And chemotherapy treated the mind, body, and spirit. This is what the definition from NCI. So the modalities of the integrative medicine in the United States is very different from the Hong Kong. Hong Kong, we know Western, Chinese and Western medicine, right? Integrative medicine, only two, Chinese medicine and Western medicine. But in the United States, we have so many, from A to T. Here you can see acupuncture, the highlight of the red color is we're familiar here. But also we can Alexander techniques and I can pronounce Sophical medicine, aroma therapy, which is smelling, okay, art therapy, aromatic, Indian medicine, right? Biofeedbacks, chiropractic, herbal medicine, so many, homeopathic medicine, all these belong to integrative medicine. It's not just only Chinese medicine. So you see a definition different from the West and us. So then in the year 1998, there's a consortium of integrative medicine of health formed. Before called Consortium of Academic Health Centers for Integrative Medicine. And now the name changed, called Academic Consortium for Integrative Medicine and Health. Okay. So originally, only 1999, only 8 universities, including my university, which is University of Maryland, the part of the founding universities. Duke University, Harvard Medical School, Harvard University, Stanford, some of you're very familiar with. And these universities formed. But now there are 75 members, including Canada, University in Canada, the University in Mexico, University in Australia, and Brazil. So all the schools join. So they have annual meeting, annual conference, discuss all the change experience of how to use integrative medicine in healthcare provider for the clinical treatment and education for medical student, and as well as research, they share experience. So it's very popular now. So the activities of integrative medicine is mainly one is the research, as I mentioned earlier, the other one is patient care and education for medical students, and on information to how to inform the public about the integrative medicine. It's one of the goal of the integrative medicine practice. And dissemination mainly they publish the paper, research paper, to let people know what the findings, scientific findings of these alternative medicine or integrative medicine. So this is the area. So the research area, first let me discuss research. Research in integrative medicine, one is the integrative approach for pain management. You see the United States very much emphasize pain for military personnel and veterans. That's the one area they are focused. If you visit their website, and pain method, because in the United States they have opiate crisis, right? Because of the pain, they take lots of opiate drug killer, the painkiller, and lots of side effects cause the death. Okay. And the other one is called integrative approach for symptom management in cancer patients, okay, and cancer survivors. So these two areas very much used integrative medicine. And these two areas is also weak in Western medicine. They don't have much approach to help patients. So then looking for what we call evidence-based practice. We have to base the evidence or scientific evidence to provide service to our patient. So then how we determine the evidence is strong or evidence is weak. So then tables also very long time ago they published the triangles. You can see the bottom, the opinions of the respected authorities or report of expert committee. They only consider opinion. They even not consider evidence. The evidence must be repeated treatment. You can show again and again. But golden standard now is RCT, the randomized controlled trial. You must have controlled trial. And further high, the systematic review of the RCTs is the highest strong evidence. So bear in mind that this is evidence we use to help us to inform our practice, how we use the information to help our practice. So then here's the 2014, the U.S. Department of the Veterans Affairs, they published their findings of the evidence map of acupuncture. So here they found 1,223 citations. They found 183 systematic reviews met the criteria from 2005 to 2013. So here the pie, they use this to look at this three first priority issues in the military veterans. So the pain, lots of soldier, the injury in the war zone. So the pain is the one, and the wellness, the second one, and the mental health, third one. Okay, these three is a major issue they focus. So the majority of the paper is about pain, research paper. So here is the way they analyze the effectiveness of the treatment. On the right side, the panel, it shows evidence of the positive effect. If the the circle fall into this panel. That means show the evidence of supporting evidence. If the second panel means evidence of the potential positive effect, may not, right? Potential. Then the last one, the left side, the evidence of the no effect. So this is the way they categorize the effectiveness. So here you can see the pain level, headache, chronic pain cover many different diseases, right? And migraine headache, migraine also part of them. The circle, big or small, because sample size. If a bigger sample size, a bigger circle. So you can see this is definitively define the evidence of the positive effect is at a bigger sample size, very supporting. So then also the other area as well. Okay. Then I skip other slides about the evidence of the well-being and mental health. Similar. Okay. So then the research paper we published in the recently published paper 2018, okay, by Columbia University. They used acupuncture for cancer, the cancer patient disorder. So this study very well known, published in JAMA, Journal of American Medical Association. And the people want to see this, the investigator want to see whether acupuncture can help the patient who take the aromatase inhibitor among the women with early stage of breast cancer. So this aromatase inhibitor is for the cancer prevention and particularly prevent their recurring. Okay. Now, this medication will take a long time. It takes not only once, twice. So when one of the side effects of this medication is caused the joint pain. So lots of patients are reluctant to take this medication because of pain, so much pain. So then they want to see, because the Western medical doctors do not recommend the patient take the pain medicine because they worry about the drug interaction, right, between the pain medicine and the aromatase inhibitor. If you take a long time, so they think maybe acupuncture can help without pharmacological intervention, just only mechanical stimulation. So the question is, they raised, does acupuncture reduce joint pain related to the aromatase inhibitor among the post-menopause women with early stage of breast cancer? Okay, this is what they process. So here the design, they have three groups. One group with over 100 people receive real acupuncture. The second group with sham acupuncture, which is placebo acupuncture. And the third one is nothing. They did not receive any treatment, just the wait list. They wait until their term. So there's a different treatment every time, 20 to 25 minutes, and no electrostimulation used. And course 2.5 sessions for 6 weeks, means twice a week for 6 weeks, and followed by one session per week. So here the results, if you look at it's too small to see, but you see the highlight with the yellow color. The all yellow color means significant. It means p-value is smaller than 0.05. So this compared to the sham acupuncture and compared to wait list. You see all from the worst pain. Patient ask what's the worst pain level, or average pain, or pain interference, and pain severity. All these parameters you can see significantly acupuncture better than sham control, as well as the waiting list. So the conclusion from also is results indicated that a significant, statistically significant reduction in the joint pain at week 8, after 8 weeks of treatment. So very powerful. So let's give example, because the time limit, I'm not going to too many research paper here. There's lots of research paper have published. I highlight a couple important ones. So in patient care in the integrative medicine is the second part I want to discuss. We mainly emphasize the evidence-based practice, not based on only experience, or based on research. Because before we did not have the evidence. We have the based on experience, right? And the year practice. Okay? But now we have lots of evidence. It's scientific evidence. We can use the evidence to help us to make a better decision. So So here, evidence-based is also well-known figure. The evidence-based in the middle in the center, we're based on relevant scientific evidence, but not only the evidence, we also based on clinical judgment. Your clinical, the experience also take place. Then patient values and preference. Some patients have two options of the treatment. They may not choose the treatment with lots of side effects. They may choose some other mild effects. For example, use acupuncture or use the painkiller. People may use acupuncture instead of the pharmaceutical pain medicine because they worry about the side effect. So patient could have the preference, have the freedom of choice. They can choose which one want. So we all combine three together to guide us the evidence-based medicine or evidence-based practice. So here the way how to use the evidence practice. First, if a patient comes into a clinic, then you have a question, how do we treat the patient? Okay, then you go to ask clinical questions. So commonly in the acupuncture clinic, a very common question is, I met, how long should I be here? Okay, I come here, you treat me very well, my patient much better. So if I don't come back, the pain come back again, okay? So how long I have to come back again? Is in my whole life or how long? So nobody can answer the question, right? Because textbook of acupuncture textbook, no textbook tell us how long the treatment, how often the treatment, right? So evidence-based research paper can tell you, okay? So you have these questions, then you go to acquire the best evidence. How to get evidence? You go to PubMed, Medline, go to the website to type the keywords acupuncture and whatever headache, low back pain, then pop up lots of the publication, research publications. Then you look in the publication, what information they give to you. For example, the one study just showed in Colombia, they said after 6 weeks, twice a week, 6 weeks, the joint pain will significantly decreased. Then you can tell patient, you should come twice a week for 6 weeks. Majority of patients will be experiencing less pain, okay, because you have the evidence to support you. It's not just based on your brain, okay. Then you praise this evidence. How to praise the evidence? Because the scientific paper is reliable or not. The journal is high impact or low impact. Is it the peer-reviewed journal? Okay, so this determine like a JAMA paper. We trust them. JAMA paper is good journal, right? We use the paper of JAMA. We don't use the lower impact factor journals. That's how we praise. Of course, we also often train practitioners to understand how to interpret the data. And sometimes they say very good results, but if you look into the design, maybe not very good design. It's not very convincing methodology. So this is called praise the evidence. Then you apply the evidence. If you think, oh, the evidence is very strong, very convincing, then I want to use the evidence to apply on my patient. But that's not enough. Then you have to assess your performance. After you give the treatment, then you see whether a patient getting better or not. If there's still no improvement, there's something wrong. You have to go back again, the cycle again, go back to step one again, you search again, get more information. Or you ask the one question, but then you cannot find another question. You have to keep search, okay, then to help you to have better practice. This is called evidence-based practice. Okay, so now there's a couple of national surveys showing an increase in the percentage of the physician office, okay, Western medical physician office visits, that including complementary health approach between 2005 and 2015. This is the paper published was from NIH. They did a large sample survey. They asked doctor in the office. So I highlight a couple key points. So complementary health approach were included in about 8% of the physician office in 2015, compared to only 2% in 2005. So 10 years they jump from the 2% to 8%. See, more physicians willing to incorporate the complementary medicine in their practice. And secondly, called complementary health approach visits primarily involved the patients who were at least 45-year-old female. Okay, so these kind of patients very willing to use the non-Western medicine. So 45-year-old female, more white people, and covered by insurance. They were willing to try different approaches. And percentage of the visits where a complementary approach were provided or recommended was highest for visits involving fibromyalgia, IBS, cardiovascular disease, and menopause. This area they found that most people come to get complementary medicine in this area. Okay, so that means in this area, Western medicine have really no any good treatment. Okay, so they're looking for alternative. Complementary approach were provided or recommended more frequently when the chronic problem was the major reason for the visit. Okay, so usually Western medicine acute problem is easy to treat, but the chronic will be more difficult because they have taken a long time on the medication. So analysis of data giving insight into the complementary health recommendation from the U.S. physicians. Of all U.S. physicians, 53.1% recommended at least one complementary health approach to their patients during their previous 1 year. Okay. Massage therapy was the most commonly recommended complementary health approach, followed by chiropractic, osteopathic manipulation, herbal non-vitamin supplements, yoga, and acupuncture. This area is the most recommended by physicians. Because of what? Because lots of evidence. The evidence show this approach help patients, and the physician willing to recommend. Reasons physicians recommend the complementary health approach to patients, there are reasons. Okay, findings show that the physician who recommended the complementary health approach often based on their own personal use of approaches, means they have good benefit, good results. Evidence in peer-reviewed literature, as I mentioned earlier, they found little evidence, and they recommend the treatment to the patient. And recommendation from the colleagues. And these three ways they encourage them to recommend patient these approaches. So here in the U.S. Maryland, where I work, you can see we have helicopter from the shock trauma from East Coast of the United States. They bring the patient to the hospital, then they stabilize. Okay, no life danger. Then they ask acupuncture. I was the one treat the patient, so relieve their pain because they cannot get too heavy narcotic because they are a critical condition. So acupuncture can have their pain sense intact. And cancer center and heart center, they also use lots of the complementary medicine. Okay, I remember the one study they did. They used the cardiovascular disorder. They used laughed. They used to show comedy in the room. Then they see the comedy make patient laugh, happy. So they found that the group with watch the comedy and much better recover compared to people who watch the serious news media. Okay, here are a couple of examples on how popular acupuncture and Chinese medicine used in the United States in cancer center. Okay, this is the Memorial Sloan Kettering Cancer Center in New York City. So here, if you look at the website, you can see our underlying bottom, the acupuncture, one of the service they provide to their cancer patient. So if you look at another very well-known cancer center called MD Anderson in Houston, Texas. And also in the website, you can see acupuncture also in the part of their service for their patient. In Baltimore, Maryland, where I live, Johns Hopkins Medical School, if you look at their website, you can see acupuncture in Chinese medicine is one of the medical service for their cancer patient. And finally, Dana-Farber Cancer Institute of the Harvard Medical School in Boston. That's also in the website, the acupuncture top one, the service they provide to their patients. So there's lots of the acupuncture used in cancer care. So this is survey, American Hospital Association. They did two surveys. In 1998, their survey, they find every 100 hospital, about 8 to 9 hospitals provide the service of complementary medicine, which often included acupuncture. 10 years later, 2008, they had the same survey again, and they found the numbers doubled. 20% of the hospital, they provide acupuncture service. So here, another survey from the 2010 Health Forum Complementary Alternative Survey of the hospitals. They found that 42% of the hospital, they provide acupuncture as outpatient to their patients. So another survey from NCCLM, they found that there are 6 top modalities of the complementary medicine in the hospital, in the United States hospital. The acupuncture is ranked number 2, second. Ranked number 1 is massage. Massage is most popular. Acupuncture is second popular. So you can see how popular it is. So the physician opinions again changed over time with acupuncture. In the 1980s, only 20% of physicians believe acupuncture and think acupuncture is a legitimate treatment. But now, in 2020, the percentage of physicians believe acupuncture is 80%, reversed number. Okay, so more physicians recognize the acupuncture. Why? Because the research evidence, the evidence shows acupuncture, scientific evidence. They're willing to refer patient to more patients. Okay. So this is about the opinion. And here, let me introduce a couple the models of integrated medicine setting in the United States. The model for paper, I used the Lin paper. You can look at the paper yourself. There are 5 different modalities. One called coexistence modality. Means we have the group of the practitioners. We have physician, we have the medical doctor, we have acupuncturist, we have physical therapist, we have chiropractors, maybe together. Okay, we establish the center. This center may be financially independent. We everybody charge their own patient, but they can refer each other, can help each other. If patient need to come to acupuncture, maybe needed to take a look at the X-ray for MRI, they refer next door. Physician can take X-ray for them. So this is called coexistence, or a multidisciplinary center. The second model of the common is a cooperative model. That add one person to the group. The group practice already, but they feel something is missing. We need something else. For example, very often in the group practice, we need a nutritionist to tell our patient how to control their diet, for example. And then they recruit the nutritionists into their group. Okay, this is called the second model. The third model called cooperative, run jointly. So together we run together. Okay. So maybe when the leader, they pull a couple people together, then run a center, then have different office to rent to different people. And collaborative model also conducted by 2 or more parties working together. So maybe Western medicine party and TCM party together, and then each one they have acupuncturist, and Western medicine could have the GP, and could be orthopedic, and then together. So this collaborative, okay. And the other one called patient-centered, based on patient. Then everybody to see the same patient use different experts, okay, or team-based care. So these are 5 main models. And 3 types of system they use. One is called independent system. Means you rent office there, but the charge you take care of yourself. Okay, nobody you own your money. Okay, if patient come to your clinic, they pay you. You get money. You pay the rent. So, but they work together. They can refer patients to each other, but they independently, not belong to each other. The second one is dependent. Dependent, they form group. They have same financial. They have the usually bigger company. They have the financial officer. They can take care of this. They do advertise together. Okay, then the income they split. Okay, based on each contribution, they give money to each people. So this is called dependent. The integrative means they work together. It may be kind of mixed with the independent. So on the basis of level of the involvement of general practitioners and complementary alternative medicine practice means here means general practitioners means Western medicine doctor, and complementary alternative means the acupuncturist or herbalist. They can work together to see what the best combination. Okay, so this is so far I talk about the research area and talk about the medical setting in the United States and definition. Now we talk about education. Education, the two layers. The early stage mainly by the Western medical schools, Western like Hong Kong U Western Medical School, right? Integrated medicine education in the Western medicine school. Then also later on I discuss about integrated medicine education in acupuncture TCM school. Okay. So here, training in Western Medical School, we see this is the very well-known Andrew Wells Center in Atlanta. So Dr. Wells, he is the one founder, see the middle, he's founder. He's created by Dr. Andrew Wells in 1994. The center trained over 160 fellows every year have 160. So these fellows are Western medical doctor. Okay, they go over there to get training for different type of the conventional medicine. Unconventional medicine, then when they practice, they know how to use other modality for their patient. Okay. So if you look at the curriculum, then none of them acupuncture actually. You see they have nutrition, health, they have botanical and dietary supplement, and mind-body medicine. They have traditional whole system healing and integrative approach. So not necessarily acupuncture. So they want to expand the knowledge of the medical doctor and more way to treat the patient. That's the person. So this is their center. Okay. So then another one called Helms Medical Institute. Helms Medical, particularly exclusively only acupuncture, for medical acupuncture. So the name, they educate the physician in the science and art of the medical acupuncture. So in the United States, we have Acupuncture Society. They have a very big organization. They established in 1980s. Okay, this is in the UCLA. They train over 6,000 physicians with acupuncture so far. This in their website. So this mainly they train them about 200 hours combined with the on-site and distant learning, online and videotape. They learn this. So this is the University of Maryland School of Medicine, the Center for Integrative Medicine, where I worked there. This is the office, is Integrative Medicine. This is the lecture hall. Okay. So we have the program for teaching medical students every month. We have monthly clinical training for the acupuncture for the medical student. So about 1 hour. The most popular experienced patient student like is experience the needle in the body. So usually before the start of the lecture, I give everybody needles, okay, in the body. So nobody fall asleep. It's lunch time. They all fall asleep. And I start to talk. Nobody will fall asleep. Very interesting that time. So this is also the U.S. News and World Report. If you notice, during very well rank different universities, they interview us in 1996. They published the paper on us. They interviewed me, and they said this is the first medical school in the United States not to an Asian art. Means you bow to Asian art. They agreed Asian art can be used into medical school. Okay, even though not training medical students to do acupuncture, but we teach a student what about acupuncture, what science underneath. So when the student graduates, become a physician, they can refer their patient to the acupuncturist. That's all about. So then recently I was invited by Georgetown University. They have integrated medicine. I was given a seminar on mechanisms of acupuncture in Georgetown Medical School, the physiology department, integrative medicine program. So this is also another program in the medical school. So remember in the slide I showed you 75 medical schools, they have integrated medicine. This is the one of them. It's after seminar, they give us photo together. And what about the integrative medicine in the School of Chinese Medicine and School of Acupuncture? In the United States, about over 50 schools are currently accredited by Accreditation Commission for Acupuncture and Herbal Medicine, ACAHM. So in this school, many schools start to change the name, become integrative medicine. Now, this school is also, the 50 schools form a council, the council called Council of College of Acupuncture and Herbal Medicine. They have a yearly meeting. So they're committed to the excellence acupuncture and herbal medicine education. So I served the board member, and when I came back, I served the board member of the executive committee of this council. Okay. So we have another organization called accreditation organization. This organization called Accreditation Commission for Acupuncture and Herbal Medicine. Before they call Accreditation Commission for Acupuncture and Oriental Medicine. They think Oriental medicine is discriminative to Asian people. They changed to herbal medicine. So this is a website, you can visit them. They accredit every school. So you meet the 14 now to 11 essential criteria. So our school is one of the accredited schools. So commission staff, I want to show example John Yu is currently the CEO of the University of Virginia University of Integrative Medicine, my school. He's John Yu. He now become chair of just elected by the commission as the chair, oversee all the schools. So this is the University of Virginia University of Integrative Medicine, Virginia. This is the building. We just purchased the building just last year, new building. One of the office there, my office there. Okay. Okay, so I'm the board member, board of trustee, and the founding Jane is the founder. John Yu, as I mentioned earlier, CEO. I'm the president. So here, there's introduced a little bit about education in acupuncture in the United States. So minimum of 105 semester credits, which equal to 1,905 hours. At least 3 academic years, 3 years. You can get a master of acupuncture, only acupuncture, 3 years. So it's very similar to the School of Chinese Medicine here. We have the 700 hours acupuncture theory and TCM, and 660 hours about clinical training and biomedicine, 450 hours. And other skill also teach the counseling, communication, practice management, 90 hours. Okay, so the combination about 6 to 4, I think, to 4 ratio TCM and Western medicine. So here, if we look at the master science of the Oriental medicine, they have 1 more year, 4 years, total 4 years. They have 2,980 hours, 90 hours. So one more year, you learn herbal medicine, not only acupuncture after this. So here is the Oriental medicine, acupuncture together, and this is the biomedicine, see? So the ratio about 6 to 4. So this is some picture show you that the acupuncture training. We have a look at our space very similar to this building. We have the difference is that the patient treatment by students, not by our faculty. The students treat the patient. Okay, so here's 2 fellow students. We have a student 2 together. One is the senior student, one is junior student. They always grouped together. So senior student more performing the treatment, and the junior student mainly hold the needle for them, help patient. So it's very nice because that when the senior student graduates, move on, then junior becomes senior. Then they can help the younger the student. So save lots of time for the faculty supervisor. We don't have to teach you everything because they learn each other. So they perform the treatment. So typically, then at the end of the slide, I don't have time. Then usually they interview the patient, then come to the the room for consultation and to the faculty of the supervisor, and ask us the patient pulse, diagnosis, and we go back to look at the patient to confirm the findings, and we prove or say, okay, you can start treatment. Then they do themselves. Okay. Usually in the beginning we watch them a little bit, but after you watch a couple of times, some students very good skill, then we let them do themselves. So this is the overtraining. So this, the middle one, the left one is the student. The right one is the younger, the supervisor, okay, the teacher. Okay, teacher watch the student to prepare the herb. So this powder herb, they prepare themselves. So they use the device, like a plastic device. They use a spoon. Every spoon equal to 5 grams of the herb in the ratio is 1 to 5. So 1 gram equal to 5 grams of the raw herb. So then put in the plastic bag, then they can, I have more slides, I decide not. Then you seal it and they give the patient. So I want to emphasize that different from Hong Kong, the patient, student treat the patient, not the faculty. And that's the difference. So they independent, they have to treat 250 treatments they have to do before they can graduate. Okay, so then the one area we want to, in our training, since I'm there, this particularly when I was the professor there, we want to emphasize integrative medicine training. So several areas we reflect. One is called case study. So we have 3 phases of the training. Okay. Each phase, like 50 hours, okay. When they finish the 50 hours of training, they have to choose the patient they see. Choose one patient, write a case report. They have to present to supervisor, okay. They call it case report, okay. So there are 3 phases. They have report 3 times, okay. In the case report, the format, I provide the format. One of the area we want them to call assessment. For example, this example, chronic low back pain. Okay, then they have to find the literature. What other possibilities could cause the low back pain? See, here I can see osteoarthritis, stenosis, spondylosis, fracture, okay, even cancer, metastatic cancer. So the student will understand that when patient come in with one symptom, they have differentiation. They know what the possibilities the patient may have. We train the student to memorize. So after they do a couple of times, they know the patient. They search literature. And also they have to know the side effect of blood pressure. Some people have edema, for example, edema, then they have to know what the possible cause of edema. Side effect of high blood pressure medication could cause edema, for example. Liver cirrhosis could cause edema. So they have to know all the possible disease to cause the symptoms. Then they can refer the patient to different doctors. They call integrative medicine. Then we have to also require them to find at least 2 papers to support their practice. For example, in this case, if they have low back pain, chronic pain, here they have to highlight one sentence from the paper. So according to randomized control trials reported by CHO-ET-AL 2013, VS score for both soreness and pain intensity score of chronic low back pain significantly improved in acupuncture group compared to sham group, p smaller than 0.05, after 60 weeks of the twice-a-week treatment. So this evidence they find, they have citation down there. Then they have to find another paper about meta-analysis or systematic review, which is more RCT together. They say, according to meta-analysis of randomized control trials reported by Vickers, 2012 acupuncture treatment was more effective as compared to the conventional medicine or compared to sham acupuncture, p-value smaller than 0.5. 95% of the interview they have to put here, okay? So there's the evidence there. So every research, the clinical study, they will present to this. Otherwise, I will reject if it not improve this. So they learn by one, case by case. They're familiar with all the papers. So they can inform their practice based on this research information called research-based practice. Okay, you must based on the research findings. Yeah. Okay, then our schools, we have the same as Hong Kong U. We have the board examination, right? We have the board examination every year. We also have board examination. We call it NCCOM, National Certification of Acupuncture and Oriental Medicine. So the passing rate, because how many people you take and how many passed. So we have national level. So the red color is the national level. Okay, blue color is our school. It's called VUIM. So before I came over there, so you see, this is the foundation of Chinese medicine, basic theory, okay, TCM theory. So then the 2002, the passing rate is 80%, far below the national level, 95%. Now, 21, 22, they're very close, close to national level, okay. So acupuncture part, you can see also in the beginning, 2020, also behind the national level, but now we're all over similar, close to the national level. And the urban medicine now far better than the national level. So here, 2020, 2021, 22, they're all over national level. So biomedicine is also better than national level. This is our school's data. So just let you know. Okay, this final. This picture I took in March in Iceland for the Northern Light in Iceland to share with you. Thank you very much. I'll be happy to take some questions. Thank you.
Thank you very much for Professor Lao's excellent presentation. And from the concepts, research, education and clinical practice about integrative medicine in USA, particularly in education and training system. So now we are Q&A times. Any question? Okay, Chris.
Hi, thank you for the presentation. I can see that there are so many streams of alternative or complementary medicine, and Chinese medicine is one of them. So from a global perspective, strategically, shall we join the other streams of alternative medicine in the fight for getting into mainstream, or do we better off to promote ourselves?
Good questions. But currently, the fact is that every modalities, they have own organization. Okay, they not combine each other. We actually compete each other. For example, now physical therapists try to include acupuncture as dry needle now. So they fight each other. Acupuncture Society don't want them to include acupuncture. They think this belongs to acupuncture. They said this dry needle is not acupuncture. So actually not that true. But all modalities want to get into the mainstream. Okay, so how to define what means get into mainstream? So the major purpose for every modality is get insurance coverage. That's all. Okay, if it can cover by insurance, covered by Medicare, by federal insurance, then means you get into mainstream. Okay, not just a name. Okay.
So do we join them, or do we fight?
Certainly, I observe only fighting more than join together. Not much joy. I don't see any sign they work together so far. But in the United States, very unique. They don't totally join. They are lots of freedom. Everybody can do whatever you want. Okay, that's very different from the concept of the Asian concept. We don't want to join force or something like that. Good question. Yeah.
Dr. Yong.
Thank you very much for your nice talk. And I'm curious about your, the curriculum. Since you mentioned you have large portion of courses are in biomedical science, I'm just wondering whether your university could offer all courses by yourself.
No, it's not. Because the biomedicine courses, we have very clear goal. Okay, we not teach them as a Western medical doctor, right? So we want them to recognize the disease. If patient they understand when physicians say this disease, they understand what disease. They understand the pharmaceutical side effects. Okay, so they understand. They cannot practice because in the United States, the license very clear boundary, like in Hong Kong, you cannot use Western medicine. So you understand Western medicine, so you can communicate with the Western medical doctor. You have common language in each other. That's the purpose. So the level of training is much lower than medical school, but enough for practice outside. Thank you, Professor Wang. Yes, please.
Do they need just like Hong Kong? We have CPD, to get the certain points every year. Do they have the same thing?
Continuing education?
Yes.
Yes, yeah, we have. Continuing education based on different state. Usually about 40 hours. Also, there's but now more and more states use the NCCOM, which is the National Board Examination. Their board. If you pass the NCCO examination, then you can certificate, right? So every 2 years or every 4 years, you can renew your certificate. Then you have 60 credits you have to complete before you can renew. So when this happens, many states, they want to save their manpower. They don't want to have another the community education credit. Yes, if you meet the requirement for NCCOM, you can be qualified for the license here. So this means only one state, California, they have their own board, their own examination. They're very different from other states. Most states about 40 hours. Yes.
Thank you, Professor Lao. I wonder if you see any development.
Introduce yourself.
I'm Denise from School of Nursing. I worked with Professor Lao for some time when he was in the School of Chinese Medicine in Hong Kong U. I wonder if you see any integrative medicine training in other healthcare professions like nursing in the United States?
Yes, actually lots of nursing school now they incorporate acupuncture and lots of research. I remember in the University of Maryland, they have a school of nursing. They have one, I think the name is Suzanne. I remember she got a large grant of research on acupuncture and also acupressure like you did for the patients. Yeah, they do. But still, this is very individual. So one area we have a united area is called Society for Acupuncture Research, where you serve the ambassador, right, in Hong Kong. So then we have annual meeting. So all different schools, different area, they share the experience or their research findings in this conference. So we have every year. And so next week, we have a conference. When I go back tomorrow, I'll join the conference in New York. Thank you.
Professor Wang.
Thank you, Professor. Actually, I would like to take this opportunity to voice some of my opinion of what we should be doing in Hong Kong in integrative medicine. As you all know, I donated the endowed chair on integrative medicine in Hong Kong, and that is not my vision. I'm sorry to say what is happening in North America is the Americans trying to stifle Chinese medicine in North America. And that is not what we want, right? I mean, in China we have Chinese medicine, and in China, 中西醫結合, all right? So this is basically, we are incorporating Chinese medicine with all its, our theory of Chinese medicine practice and all the other basic theories that we have over the years, modernize it, and then use it. All right, we do have acupuncture, but our acupuncture carries much more than what is being practiced. Just anyone picking up a needle and just, finding your acupuncture points. So I'm actually thinking that, in Hong Kong, we should be doing much more than this done in America. In America, like Professor Tommy Chang, all right, CGCM is actually, being operated in Hong Kong by our faculty. It was started in Hong Kong U, the Consortium for Globalization of Chinese Medicine. But even Tommy is saying that he won't say anything about Chinese medicine. He said the future of medicine is medicine. It's Western and Eastern. Why is it Western and Eastern? So he's avoiding the word Chinese. He knows. I mean, he's Chinese. He's been in Yale for so long, and he knows that in North America, in the United States, there's no way you can actually say Chinese medicine and survive. So therefore, the list of names that Professor Lao has actually shown us never show a word of Chinese in it. You see, that is very important. You notice that is avoided. If you have Chinese, it will not survive, period. All right? So therefore, that is North America. And this is not what we want in Hong Kong. Right? If we can do it in China, Hong Kong is the gateway for Chinese medicine to the rest of the world. So we should be doing it, tong tong jing jing, all right? We are doing Chinese medicine, therefore it's Chinese medicine. And therefore integrative medicine in Hong Kong is integrative Chinese medicine with Western medicine. And I hope that, Professor Fung and Professor Zhang would actually do this for our students. So we asked how much they are learning. We learn much more, right? In our medical school, we learn much more Chinese medicine, right? The only thing is that now we should be talking about how we educate our Western medicine, not only nurses, but also our Western medicine medical students and doctors on the practice and the theory of Chinese medicine. And then, only then we can actually work together. In fact, just last week, I couldn't attend your lecture at the PolyU because we were actually having, an integrative medicine center operated by an NGO. In fact, at PolyU was actually Professor Wang Wensao was actually part of the team that we do it. And the important thing is we are saying that we have integrative medicine service, but the Western medicine people should respect the Chinese medicine people, and we work together. And more importantly, now we are talking about modernization. Okay, so what do we modernize? We modernize by doing proper scientific research. We have been doing it all the time. The randomized control trials, which is allowed in doing for so long, right? So those actually are accepted by Western medicine, right? So if we have randomized control trials showing that it works, so that works. But the trials may not be just Chinese medicine versus placebo, all right? They are talking now about not using placebo. I noticed you showed that in the PolyU lecture. But rather, we could have, one arm with Western medicine plus Chinese medicine against gold standard Western medicine, all right? And Chris and I have been talking about diabetes, mellitus, and the use of Chinese medicine on top of Western medicine. And then it works. So this is something that we can work together with the Western medicine doctors, all right, and obviously I'm one of them, and then actually do better to help our patients. This is the goal. This is the vision, that we should be doing this, all right? So I came here in order to actually be able to share with you, this is the passion. And then I hope, in fact, Professor Fung and Professor Zhang would actually do this. Now we are in a position to do so now with the new dean, and we hope that the Hong Kong University can actually have a proper integrative medicine center in which we work together, hand in hand with Western medicine doctors, and we are given the full respect. Chinese medicine practice as it is, but we are now modernized, we are scientific, we can prove how it works, how the acupuncture works. Professor Zhang has done all that. We know how it works, all right? So then we scientifically, and also we know that it works. How it works together with the Western medicine, we are doing a lot of new trials and they are actually being published, right? So therefore, and for example, we used Chinese medicine to treat COVID-19, for example. We can publish it in the American Journal of Chinese Medicine, and it is actually well accepted. So this is the way to go. I don't want to see the young people here. I suppose most of you are Chinese medicine practitioners to think that this is the goal. This is the goal in America, in USA. But this is not the goal in Hong Kong, nor in the rest of the world. And I hope that we can work together to actually deliver much more of Chinese medicine to the rest of the world. Thank you.
Thank you very much, Professor Wang. Actually, I agree with Professor Wang, because Chinese medicine in Hong Kong, in China, although in Great China, we have a strong culture base, we have a strong ground of Chinese medicine legal system. Now in Hong Kong, Western medicine and Chinese medicine both are legal medical systems. We can do diagnosis and treatment independently, and also integrative medicine with Western medicine and Chinese medicine. And now our Hong Kong U and Professor Liu and Professor Lin also in here, they are post-integrated medicine in Hong Kong U. I think, as Professor Wang said, in Hong Kong we have more good condition to do this work. So as Professor Lao showed us, integrated medicine in USA, their concept of integrated medicine broaden because the elements is more than one. But in Hong Kong, we just Chinese medicine only one. So we do integrated medicine. We have a good position and a good whereas ground support, education system, university support, faculty support, and we're under Faculty of Medicine. We have a strong Western medicine support. And now, most Western medicine departments, they are support to do integrated medicines. Because Professor Lao also in our school as a director in the past 6 years. So as you experience, compare Hong Kong and the USA, how do you think integrated medicine between USA and in Hong Kong?
Okay, this is a very challenging question, very difficult to answer. They both have a good advantage and disadvantage on both sides. So, certain parts. Let me talk about the education part. The education part, as I mentioned, the training part in the USA, they very much train independent skill. So every student, when they graduate, they can open a clinic to themselves because they require independent treatment for 250 treatment before they can graduate by themselves, not just supervisor tell them they have to do themselves. So this is a good part. The weakness of this is that we don't have a hospital. Lots of schools, they don't have affiliated hospital. They don't see the very challenging disease. So this is what we can see. We have in Hong Kong, we're going to have a Chinese medicine hospital, right? Also, we send students to the mainland China. We go to hospital, see very critical condition. So this is different. So both something. But here I feel students are not so independent. That's my observation. They everything they've like baby care, care them. You should do this, do that. So they're not allowed to do independently. So this thing maybe we should consider to make more, give the more training with the independent. So this is about the education part. But the other part of the practical part in the West, because the society is different. Every society, they have freedom, they can compete each other. So every modalities, as some students mentioned, Chris mentioned, that they combine together. Usually they find themselves with their own modalities. So this is the unique part. Here you can have organized by government, by society together, work as the task force, for example. In the United States, everybody, but they're also very active because everybody wants to get into the best benefit. So they work very hard. Okay? And every day they have, for example, actually coming Sunday, I'll go back, I give a talk in ASA, means American Society for Acupuncture, the largest organization of acupuncturists. So the Sunday I'm going to talk, but Monday they're going to Capitol Hill, lobby to cover acupuncture in Medicare. They do themselves, but they don't combine other people. But every people, they have their own principles. So, but all different aspects work together, eventually make the integrative medicine more. But the one thing for school, the research part is we have to provide the evidence. The reason I don't want to answer Vivian's comment is that about the urban medicine. The reason so far in the United States not so popular with urban medicine and no scientific evidence, no research paper. So FDA only so far only approved 2 was called literature, right? Ganzhao. The other one is green tea, a little bit. So unfortunately, if we have lots of evidence like the JAMA paper I just showed you, then it would be much easier to promote the urban medicine in the United States.
It's money.
Actually, they pay lots of money already. Like Tianjiang, Dancing Diwan, they almost finished. They finished, but not published. So it's a failed study.
Thank you very much.
Yeah, sure.
Professor Lao. I think because now is last time I be Professor Lin, our associate dean, and he was WHO Chinese medicine leader many years ago. Now is our Hong Kong associate dean, and also she is very strong push Chinese medicine, Western medicine integrate. Professor Lin, please give us the questions.
Thank you very much. It's wonderful to see you, Professor Lao, back in Hong Kong. Thank you very much for the talk. I mean, I think that we are looking at very, very different contexts here. Personally, I'm troubled by the use of the term integrative in the U.S. because I think so much of what gets talked about is actually not truly integrative. But it is, I mean, to some extent, Western medicine co-opting and incorporating certain modalities, and there is some integration, but at the end of the day, all these different modalities labeled together, lumped together, it's really just different modalities that are not seen as mainstream. But I think this is, I mean, having spent, of course, many years in Australia, you see a similar kind of thing, although the Western medicine profession is not as dominant in Australia in the same way, or rather community acceptance of complementary modalities is perhaps also quite widespread, along with registration of particularly Chinese medicine. And so I think here's an interesting issue to look at from a policy viewpoint, which is really what is the way a national health system recognizes the different forms of, let me say, complementary healthcare. For instance, I'd be curious to understand the U.S. better. But the U.S. has state-based registration. And I wonder what proportion of the states actually register Chinese medicine, and what proportion of that registration is only actually just acupuncture and not the rest. Because I think these kinds of institutional arrangements reflect a lot on both the power of the Western medical profession as well as the extent of community acceptance. I think registration is a very important marker. I think the financing is the other one. And in most systems, it's a question of out-of-pocket payments versus health insurance coverage. So I think there are some quite important indicators to track in a health system, as well as the extent to which Chinese medicine or other complementary healthcare modalities are truly integrated. And I think when we actually start to think about patient-centered care is when we see true integration. So we are looking very much at the development of a Center for Integrative Medicine here at Hong Kong U, and we're not using the American construct.
Thank you. Thank you very much. So let me answer some more questions. So a couple of things. First of all, the integrative medicine in the United States is about 20 years. So it's still evolving. But if you look back for the 20 years ago, it's a big difference, because one difference is that more coverage by insurance company, and now they covered by Medicare. Before, federal level, you don't even consider, not by state. Federal, they recognized acupuncture, Medicare they cover. So to answer your question about the registration, in the United States only recognize acupuncture, not herbal medicine. So every state only have so far, among the 50 states, 47 gradually increased. Now 47 have registration, have the law passed, the board, independent board controlling acupuncture. So they have, but under the scope of acupuncture, you can practice the herbal medicine. But it's different from China. Chinese medicine is a big umbrella. Under umbrella, we have acupuncture. But in the United States, acupuncture umbrella. Under acupuncture, you can have different modalities. So this is the difference. Okay. So that's, of course, the cultural difference and also regional difference. The model should be not identical, should be based on their own culture. Okay. I cannot say which is better, which is not better. So as long as it fits your culture, fit your community, fit the best service for your patient is the best. so my director, Dr. Brian Berman, said there are no Western medicine teach Chinese medicine, no Eastern medicine or Western medicine. Only good medicine or better medicine. So this only is like a weed medicine, right? Okay, thank you.
Okay, thank you very much, Professor Lao.
Okay.
Because time is over. So now we'll end the Q&A now. Thank you very much, everybody, for your coming. Thank you very much. Thank you.